Salam and welcome to Pediatric Case Review. In this episode, we'll dive into the diagnosis of tuberculosis among pediatric patients. Let's begin. Case number 1. A 14-year-old patient presents with a persistent cough, night sweats, and unintentional weight loss. On examination, there are dullness to percussion and decreased breath sounds over the right upper lung field. A chest X-ray reveals a cavitary lesion with air fluid level in the right upper lobe. What is the most likely diagnosis? A. Pneumonia. B. Tuberculosis. C. Lung cancer. D. Bronchiectasis. Correct answer B. The clinical presentation, radiological findings, and sputum examination results strongly suggest active tuberculosis infection in this adolescent patient. Case 2. A 16-year-old patient is diagnosed with pulmonary tuberculosis. The patient has no known allergies and is otherwise healthy. Which of the following is the appropriate initial treatment regimen for this patient? Isoniazid and ethambutol. B. Isoniazid, rifampin, ethambutol, and pyrazinamide. C. Isoniazid, rifampin, and ethambutol. D. Rifampin, pyrazinamide, and ethambutol. Correct answer B. The appropriate initial treatment regimen for pulmonary TB in adolescents and adults includes a combination of 4 drugs: isoniazid, rifampin, ethambutol, and pyrazinamide to effectively target Mycobacterium tuberculosis and prevent drug resistance. Case 3. A 15-year-old patient presents with a productive cough, hemoptysis, and pleuritic chest pain. Chest X-ray shows bilateral infiltrates, and sputum examination reveals acid-fast bacilli. What is the most likely diagnosis? A. Pneumonia. B. Lung abscess. C. Tuberculosis. C. Lung cancer. Correct answer C. Tuberculosis. The clinical presentation, radiological findings, and the presence of acid-fast bacilli in sputum suggest pulmonary tuberculosis as the most likely diagnosis in this adolescent patient. Case 4. A 12-year-old patient presents with 2 weeks history of headache, nausea, vomiting, and confusion. He has a history of prolonged cough associated with fever, night sweats. Examination revealed neck stiffness. Lumbar puncture shows an elevated cerebrospinal fluid white cell count, low glucose, and elevated protein levels. What is the most likely diagnosis? A. Migraine. B. Viral meningitis. C. Tuberculosis meningitis. D. Encephalitis. Correct answer C. The clinical presentation and cerebrospinal fluid findings are characteristic of tuberculous meningitis, a form of central nervous system involvement by TB. Case 5. A 16-year-old patient complains of joint pain and swelling in the right knee, along with low-grade fever. He has a history of prolonged cough associated with fever, night sweats. Imaging reveals joint destruction and bone erosion. Biopsy of the affected joint shows casating granulomas. What is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Gall. D. Tuberculosis of bones and joints. Correct answer D. The clinical presentation, imaging findings, and histopathological evidence of casating granulomas suggest TB involvement of bones and joints. Thank you for joining us.